everyone. Happy Friday. It's Rendi Murphree here, epidemiologist and director of disease surveillance, the Mobile County Health Department. I'm coming to you today from our downtown Keeler location. It's been a very busy day, so I don't have the global and U.S. numbers with me today, so we'll have a very brief report today, but we'll be back with you on Monday. So today, the Mobile County Health Department reported on 2,142 patients with COVID disease. Again, around 11% hospitalized and 5.3% died with COVID disease. It does look like the number of deaths are going down. Monday, we'll start reporting or start providing in our report a trend of the number of deaths by week of death and also the number of hospitalizations by week of hospitalization. I think we have enough data now, 233 hospitalized and 114 died, that you may be able to see some trends by week when we look at that. So I think that'll be really helpful. Again, most of our COVID positive patients are in the older age categories. About 50% of them are 50 years old or older. Those that get tested and that test positive, 59 to 60% of them are, thank you, Mark, are women. This is sort of a typical pattern that we see in healthcare seeking treatment, that women are more likely to go to the doctor or get tested if they think they are ill, and men are more likely to sort of put it off until they're much more ill. So again, about 48% are African American, just under 1% Asian, and 25% white. And we have, our numbers just continue to go up in our zip codes. And to look at the geographic distribution by zip codes, just take a look at the zip code map to see sort of where we're still seeing the highest areas and the areas of our county where we have the most people living and the most commerce and that sort of thing. So community exposure there. But a couple of our hot spots, as one of our Facebook readers noted, a couple of our hot spots are heavily influenced by outbreaks in congregate settings. So total confirmed worldwide, just over 5.8 million. Total deaths, 362,000, and 188 countries or regions are affected by COVID-19. And in the U.S., hold on, it's coming up. Maybe not. We'll look at this later. Okay, let me just move on. All right, so in our cases, again, we are seeing fairly stable proportion that are healthcare workers, which is just around 15 to 16%, and 25% of those are employees or residents of a long-term care facility. Right, our presumed recovered, we'll update that on Monday. And in our severe outcomes, we're still seeing the most severe outcomes in the older population. So people 65 and older make up almost 60% of the hospitalizations, and they make up over 80% of the people who died from COVID. In the age group sort of over 50, 28% of those make up the hospitalized cases, and around 17% of our deaths are in that age category between 50 and 64. Among COVID patients with known hospitalization, 37% require intensive care and 20% mechanical ventilation. Those are known indicators of severe outcomes and potential deadly outcomes. And then of our 114 who've died, 98 patients died in a hospital and 16 died in a long-term care facility. So that we know of, there's still been no one who died without the attendance of health care at their time of death. Today's number, since yesterday we were up around 33 or 34 cases. That was a rather small number. Thank you, Mark. A rather small number compared to what we were used to. So I'm just urging some caution as we look at the numbers this week and next week, because we had a holiday. So we really, instead of having a 2-day weekend, We had a 3-day weekend this week, and we know that that is going to affect the number of case reports because people are not going out and getting tested usually on the holiday. So we will continue to keep a close eye. And Monday, this next weekend, starting tomorrow, is another 3-day holiday for state government and county government agencies. So in Mobile and statewide, we may see another 3-day weekend effect on the number of cases that are being reported to us, and we'll continue to keep a close eye on that so that we can tease out whether or not it's a real decrease or if it's an effect of 2 holidays in a row. All right, let's see. So I see the worldwide numbers there. I'm looking for do you want to just read me what it says about the United States there? 1 point, does that say 8 million?
1,735,971.
Okay, so almost 1.8 million cases of COVID-19 disease in the United States with well over 100,000 deaths. 102,000 deaths. So it is still a very serious and real ongoing pandemic. In Alabama today, Alabama was reporting 16,823 cases with 1,800 hospitalizations and 605 that have died. One comment about the dashboard at alabamapublichealth.gov, it will continue to be updated as scheduled through the holiday on Monday, but starting Tuesday will only be updated once a day, and that is in the morning. That may have already taken effect, but if you see the numbers are not changing as often, it's because they are going to just updating that one time a day. All right. So a couple of questions from Facebook. We don't have any media questions. There's one media question that I'm going to handle offline. Here are some Facebook questions that we can deal with today. One is about the highest areas of infection with zip codes. And I want to just remind you that we're the only county in the state of Alabama that is reporting data by zip code. And the reason we do it the way we do is because we determined that under the HIPAA privacy rule, Safe Harbor Act, that we should not release the numerator of the number of cases by zip code for any zip code that has less than 20,000 people in that population. So that's why you see some masking of the actual zip codes themselves. And it makes it difficult for us to measure things, when we just look at the map once a week or once a day. But some GIS professionals with the City of Mobile and with the Mobile County Commissions are helping me with some geospatial representations of the data. And when we have more information available, like what are the trends in counties, maybe by hospitalization or testing or things like that, then we'll get it to you. But right now that's sort of beyond the health department's bandwidth to do that right now, but we're glad to have some partners helping us. Here's another Facebook question that my daughter was diagnosed with COVID at the end of April. My husband and I got tested last week and results were negative. Does this make us safe? And the answer to that is no. A negative test means that you don't have virus circulating in your body at high enough levels to be PCR positive at the time of your test. It doesn't mean that you might not test positive, 2 days later or a week later or a month later. So the PCR negative just says that at the time of that specimen being collected, there was not enough virus circulating in your respiratory system to be detected by the PCR test, polymerase chain reaction. So we just want to let people know that everyone in the world that has not been infected is vulnerable, have no immunity to COVID-19, the novel coronavirus. So you can get infected at any time through community transmission or close contact transmission. They went on to ask if the daughter can catch it again. She's a healthcare worker. We don't know how much immunity an infection with coronavirus, with novel coronavirus, confers on a patient. There are lots of studies going on to try to determine this, but right now there is not enough information to say that she would be protected from reinfection, there's also no evidence to say that reinfection occurs. So the best I can say right now is that I don't know the answer to the question about can you be reinfected or are you immune after you have a PCR test that demonstrated you had infection. So please continue to protect yourself and those around you by following those social distancing and physical distancing and practices for covering your cough and washing your hands and staying away from others and staying at home if you're sick until we learn more about what immunity means in the COVID-19 pandemic. Here's another question: with all the people in Gulf Shores and Orange Beach, is there going to be a spike? When should we expect it from Memorial Day? So the incubation period is 2 to 14 days. Most people will develop symptoms after infection at around 5 days, but it could be as quickly as 2 and as long as 14 days. So once we get to 14 days past Memorial Day, we'll be able to get some idea about the number of infections that might have occurred due to exposures around that holiday. But again, we know that the holiday is also affecting the pattern of people seeking testing. So we have to try to balance those two things, increased transmission and maybe a slight drop in the number of people that are getting tested. So I'll be looking into that this weekend and try to let you know a little bit more about what we think about that next week. But again, it will be at least a full 2 weeks before we start to see the full effect of transmission that may have occurred over the Memorial Day holiday because people were not adhering to the amended Safer at Home order. Here's a question that we get a lot: why aren't they, I guess they're talking about us or government, making it mandatory to wear a cloth face covering? This is a multifactorial decision. It's not one that can be made in a vacuum. So the health officers have a lot to consider, right? We consider what's best for human health. Behavioral and social scientists, they advocate for what's the best for mental health and for sort of our behavioral health. So some people would rebel against a mandatory order to wear cloth face coverings. There are economic things to consider. We can't provide masks to everyone, so forcing someone to wear a mask might create a financial burden on them if they don't have the means to purchase or procure or make a face covering themselves. So there are a lot of factors that go into that decision, and right, at least to date. But then we also weigh the risk of community transmission. How widespread is transmission occurring? What age groups are most dramatically affected? That sort of thing. So a lot goes into that decision, and so far our state lawmakers have decided that it's not the right time to make it mandatory for people to wear cloth face coverings when they're out in public. All right, what is the percentage of positive cases based on current testing? So again, I look at that on the weekend, so I will let you know it's been going, the percentage positive among all of those tested has been going down steadily over the last 8 weeks. And again, that's due to a rather steady increase in the number of tests that are performed. And then our last questions of the day is, are schools going to require kids to wear face coverings if they open the schools? And that is certainly one thing to think about when schools and educational facilities and institutes of higher learning are considering reopening. They will be able to do this later this summer, and everyone is trying to follow the CDC guidance as closely as possible to have a safe reopening, to try to avoid an outbreak happening that might cause them then to have to just close their facility after opening it. And certainly requiring students and faculty and other staff to wear face coverings in schools is on the table. CDC does not recommend that children 2 years or less or younger wear a face mask, but 3 and older, there are pediatric face masks that have been produced, and you can certainly sew them. So I don't know what the school systems in Mobile County and the private schools are going to do, but that certainly is something that they will consider as they're working among many other things, as they're working through their checklist to see if it's safe for them to reopen. Any questions on Facebook?
Just about covered it.
All right.
Say hello to Tyler, Texas.
Oh yeah, so we have heard, Mark, our public information officer, is reminding me that evidently we have at least a couple that live in Tyler, Texas, that are plotting a move to Mobile County, and they are in the process of purchasing a house somewhere around the county, and they reached out to us via Facebook to say that they are watching from Texas and they appreciate the daily updates. So hello to Tyler, Texas. We will welcome you as Mobilians when you get over this way, and please continue to stay tuned to find out what's going on and what's going to be your local community soon. So thank you all. Have a great weekend. If you're off on Monday, enjoy your day off. We'll be back with you on Monday with our update, and including some statistics that we have not presented publicly before. So thank you.